4 weeks ago, I started to feel extreme pain in my heel, but it feels like it's on the cusp of the bottom of my foot and in between my Achilles. And it almost feels like it's on my bone.
Sounds like maybe you have a little bit of Achilles tendonitis. What we can do is we can look with the ultrasound. We have an office here. We can identify that Achilles is inflamed, and there's a number of treatment options that we can do. So right now what I'm looking at is tendon under ultrasound. So I'm looking at the attachment at the heel, Achilles tendon, to see if it's thickened, if it looks inflamed, if there's any evidence of tears. I look at if the thickness is consistent throughout, if there was a little bit of area that may be thickened, maybe indicative of some chronic tendonitis and some inflammation in the tendon. And I can look at the tendon from the side and directly from the back to take a look. Right now what I'm looking at is this is the heel bone, the calcaneus, and this is the Achilles tendon attaching to the heel. Sometimes if people have chronic spurs or heel spurs, you can see them attaching here to the Achilles, and then I can actually look at the Achilles all the way up the Doppler on an ultrasound. It can show if there's inflammation or blood flow to a tendon. In a healthy tendon, you don't want a lot of blood flow. So when I turn on his Doppler, it shows there's a little bit of evidence of inflammation in his tendon, which can be some tendonitis of the Achilles tendon. What I am going to recommend is a non-invasive treatment called shockwave to help with that inflammation. So what the shockwave is going to do is it's going to promote blood flow to the tendon to help heal that inflammation.